Assalamu alaikum, the communication day. First scenario, you are the senior house officer in the cardiology ward. Patient name Mr. John Peterson, 52 years old, recently admitted with an acute MI, myocardial infarction, and underwent successful percutaneous coronary intervention with a stent insertion 3 days ago. Echocardiography shows mild left ventricular dysfunction, ejection fraction 45%, no complication post-procedure. Lipid profile showed high cholesterol. He is now stable and planned for discharge today. Your task is to discuss the discharge plan and provide relevant lifestyle and medication advice. The medication aspirin, ticagrelor, atorvastatin, bisoprolol, and ramipril. Here you go.
Oh, hello. My name is Dr. Alalul. I'm one of the doctors here today. I've been asked to speak to you about your discharge plan and the relevant lifestyle modifications and your medications. Can I just confirm that I'm speaking to Mr. Peterson?
Dr. Kotov?
Yes, Doctor, I'm John Peterson.
Nice to meet you. Is it right to call you John?
Yeah, it's okay.
Hey, John, how are you doing today?
Okay, Doctor, I'm doing better now.
Okay, I'm glad to hear that. John, well, actually, I wanted to speak to you about your current diagnosis and what is the plan moving forward. But to make sure that we're on the same page, could you please tell me how far you know about what's going on so that I can fill in the gaps?
Okay, so Doctor, I have been admitted with a heart attack.
Mm-hmm.
So they did for me a special type of treatment. They put a stent inside my heart, and they told me that they fixed the problem by doing that.
Okay, that's very good. Yeah, this is pretty much what is it? And how do you feel right now?
I'm feeling okay, Doctor. I don't have much pain now.
Okay. Would you like me to speak to you about why you've developed this heart attack and how we're going to treat it moving forward?
No, Doctor, I've already discussed with the other doctor about what is the cause of this condition. I just now want to know what will happen next after I leave the hospital.
Okay, yeah, that's very good. So you've had the heart attack, and now we've done the intervention that corrected that what was the sorry, we've had intervention to correct the underlying problem, and now heart attack is one of the conditions that you really need to be in medications for a long time afterward, and it might be lifelong medications. I'd like to talk you through the medications and what exactly they do. But please, if you do have any questions, please stop me and ask me. Is that all right?
Yes, that's okay, Doctor.
Okay, before we move to the medications, I'd like to ask you about some risk factors for developing heart attack. Are you a smoker by any chance?
Yes, Doctor.
And what do you smoke, and for how long did you smoke?
I smoke cigarettes. I've been smoking for 10 years now.
Cigarettes. And do you smoke anything else?
No.
And are you still a smoker?
Yes, Doctor.
Okay. We'll come to this bit in a bit. And do you drink alcohol?
No, Doctor.
Have you ever drank alcohol?
No, I was drinking socially before, but I stopped.
Okay, that's good. And are you diabetic by any chance?
No, Doctor.
And any family history of any heart attacks?
Yes, my father had one too.
At what age?
He was 70.
Pardon?
70.
70. Okay. So you did mention that you were a smoker, and smoking is one of the significant risk factors for developing heart attacks. And although we fixed the artery that's occluded and that caused the heart attack, smoking is a big risk factor for developing another heart attacks. So I think it's very, very important to consider quitting smoking. And how does that sound to you?
Yes, Doctor, I will try. But I've been smoking for a long time now.
I appreciate it. Might be hard. It is very hard, actually. Would you like me to put you in touch with the smoking cessation team? They might be able to help you to have like a nicotine patch to start with, and that would decrease your chances of craving nicotine and decrease your chances of smoking. Would that be something that you would consider?
Yeah, that would be great, Doctor.
And they can give you some medications as well that might help. So at the end of this consultation, I will make that referral. And it's very good as well. So now moving to the alcohol, it's very good that you stop drinking alcohol. But social drinking is not a problem. The problem is drinking regularly. But it's very good that you stop drinking. And in terms of like, I want to ask you, do you have any diabetes?
No, doctor.
Okay. And how is your weight?
I'm trying to stay fit, doctor.
Okay, so are you fit and doing exercise regularly?
Yes, I'm trying, but due to my job, I cannot really have flexible times to do exercise.
And what is your job, if you don't mind me asking you?
Yeah, I'm a CEO of a company.
Okay, yeah, it must be tricky with difficult times. Okay,
Mm.
um, would it be feasible to get one of the machines to exercise just before you start the days or at the end of the day if your time is very compact and busy?
Yes, doctor, I can try to do that.
I think it's very, very important to keep fit, but you need, after this stint, you need to start slow and build up your strength and exercise tolerance. So it's very important to stay fit, if that
Oh,
makes sense.
okay, doctor, I'll try it.
So now we spoke about the risk factors that might have contributed to your heart attack, including the smoking and the overall lifestyle. Could you please tell me more about your diet?
So doctor, as I told you, my job is very stressful. So I try my best to eat healthy, but sometimes when I'm at business trips or so I eat from outside most of the time.
And what do you normally eat from outside? What kind of food?
I eat some fast food most of the time when I'm on business trips.
I appreciate sometimes it's very tricky and hard when we go abroad, particularly with limited options. But nowadays, there is a lot of, like, I would say, like healthy restaurants that started to open. Maybe if you consider approaching these places for healthy food, because despite that, every now and then you have unhealthy diet, it's actually will do you more harm than good. And particularly we found in your blood that the lipid particles in your blood is quite high, which is the fat particles, and it's very, very important to have healthy diet. And what I mean by healthy diet is a diet that has lots of vegetables, and less unhealthy fat and more of healthy fat. And just to be clear, healthy fat is like avocado has healthy fat, and nuts has healthy fats, but all within the normal portions. If you'd like me to put you in touch with the dietitian and the nutritionist team, they might be able in explaining what is best for you. Would that be something that you would consider?
Yes, doctor. I can.
Great. So we spoke about the smoking, we spoke about the exercise, we spoke about the diet, and we spoke about the alcohol risk. Now, if we manage to figure out all of these risk factors, that would be really great. But even when we do all of these lifestyle modifications, it's very, very important to take your medications. And how do you feel about that?
Yes, doctor. It's okay.
Would you like me to take you through the medication and what is the benefit from it?
Yes, doctor. I would appreciate it if you just give me a hint.
Of course, of course. So you've been starting on a few medications, and maybe you know that the heart attack is caused by a blood vessel that it has obstructed, and that obstruction is because of the accumulation of the lipids and the particles, including the artery, and
Two
for
minutes
which
left.
we need to give you like two medications that thins the blood, and it's very important that you stay on one of them for at least 12 months, and the other one, which is aspirin, you're likely to stay on it lifelong. And we need to give you another medication that helps to lower the fat composition in your body, because we found that one of the blood tests that reflects the fat in your blood is quite high, and high fat will cause stiff arteries, and when you have stiff arteries, the heart will find it very hard to pump. So it's very important to take the atorvastatin as well, and particularly we take it around 7 or 8 p.m. And because we're trying to slow down the heart, we want to give you bisoprolol. It slows down the heart and decrease the demand of the heart to get more oxygen, which is very important to help the heart to recover. And we've given you another medication that's called Ramipril. It basically lowers the blood pressure a bit so that the heart does not need to beat very forcefully against a very high blood pressure. Am I making sense so far?
Yes, doctor.
Okay. So we talked about the lifestyle modification. I would love to arrange another meeting for you to speak on depth about if you do have any questions. But at this moment, do you have any concerns for me?
Yes, doctor. I was asking about if I can resume my job normally now, especially that I have a very important meeting next week.
Okay. Is it a very stressful job?
Yes, as I told you, that I'm CEO of a company.
I think it's very, very important to allow yourself to have a bit of rest, at least a few weeks, and to go slowly and gradually to your work. Despite that, we fix the problem. It's very important that you start slow getting into these kind of stresses. But I assume that you drive to work.
Yes, doctor.
So, because we fix the problem and the pumping activity of the heart is kind of good for now, I think you would be able to resume driving after at least a week from your heart attack. Would that be something that?
Yes, doctor, but my trip is actually outside of the country, so I need to take the plane in 2 days. It's next week.
I don't think there's a problem in taking flights actually. So now we fixed the problem. I don't think that you have any restrictions on flying if you feel that you are up to do it. So if you feel that you're good to do it, I don't think that you have any restrictions on that. But make sure that you take your medications and stay compliant with your medications.
Okay, doctor.
Okay. Almost time is up. I added 1 minute for the last concern she raised, which is the flying.
Thank you.
Yeah.
And I'd like to offer a leaflet and arrange another appointment with you.
Okay. Okay, perfect. Can you comment now, Dr. Gotov? Then I will comment.
Okay, so overall, Dr. Inas, you did a really great job in explaining every aspect, but there is two things I want to comment about. First of all, you take a lot of time in explaining small details. For example, in smoking, the patient is a smoker, and it is a risk factor, and you have to advise him to stop smoking and refer him to the smoking cessation clinic. But you spend so much time in the details of the smoking cessation itself. For example, the patches, you give him all of the options. So that will be the job of the smoking cessation clinic. So you have to tell him that they have different measures that can help you to stop smoking gradually, and they will give you different medications, for example. And just inform him that we will refer him to the smoking cessation clinic by the end of this session. You don't have to dig so deep in it. And you did the same thing in the medication and in the nutrition. You started to explain about the healthy lipids and the bad lipids, as you mentioned. But in this case, you already mentioned him at the end that you will refer him to the dietitian. This is also the job of the dietitian to explain to him that almond is a good lipid, for example. So I think your time did not help you because you spent so much time explaining extra details about every subject because you still have many different aspects you had to talk about. So, and in medications as well, you can just give a hint. For example, just so we can tell him that the aspirin and the ticagrelor are blood thinning medications that can prevent developing of future clots. And for the beta blocker, we can just tell him that this medication can help protect his heart, for example, by slowing the heart. Okay. And regarding alcohol, you spend some time in it as well, even though the patient informed you that he stopped drinking already. And for example, the ACE inhibitor, we can also tell them that it just improves the heart function and lower blood pressure, for example. But I think you spend much time in explaining the medications and in diet as well. So other than that, I just want you to check more the understanding of the patient. You just checked once if the patient is following you, but sometimes you usually give some chunk of information without checking understanding if the patient is following you or no, because you are giving some really important details. Okay, the other thing that you should have talked about, in this case, for example, the driving and the flying, you should mention them by yourself, even without the patient asking. And the exercise, we already talked about that. And other than that, one of the most important risk factor is the stress. We should talk about the stress, especially in this patient that he has a very stressful lifestyle. And the sex life, one of the concerns was the sex life, but we didn't have enough time to go there, even if he can go back to his sex life or no. And one of the most important thing that it will be really nice if you offer to the patient is support, psychological support. Going through a heart attack might be very stressful for the patient, and it might be not very good experience. So we can offer for him a cardiac rehabilitation program. So you can just tell him at the end that it's a society full of people with similar condition. So they will give him some exercise, education, and emotional sessions. So it will be really great if you just add this. But overall, you are very fluent, you are very informative, and I really enjoyed your session, your class. So thank you, Ms.
Thank you.
Yeah.
I appreciate it.
Yeah, thank you, Dr. Beto, for the comment. I agree about this comment, particularly the questions. I believe Dr. Ines asked a lot of questions considering taking history, like family history, like do you have diabetes?
Yes.
Yeah, so it's not allowed to give or to take history in communication scenario unless you ask about. So the only thing you can ask: smoking, alcohol, job, and the occupation, the job. Okay, the
How
job.
would I know, like,
Driving.
about other lifestyle things?
You can give her advice or instruction. So like if you have diabetes, you have to control or to call your GP or to call the other doctors to control your blood sugar. Okay, so the way to advise as instruction, not as taking history. Don't ask her, do you have diabetes? Okay, if you want to give, you can give as a instruction. You got it?
Yeah.
Yeah, the same for family history. If in case you have any family history of the same heart attack or heart problem, please review with your heart. You are the heart doctor now, or you can say, in case you have any family history of heart attack, let us know, but don't say, do you have? Okay, because you are the heart doctor, you cannot refer him to a heart doctor. This is the first comment. So don't please take history. The only allowed questions in communication scenario, family, the social, which is smoking, alcohol, driving, and the job. Apart from that, it's not allowed to take history. The introduction was good. As you ask, how do you feel now? How are you? What do you know to say, to be in the same page and to fill the gaps? It's okay. You can ask him what about your expectation about this meeting. He will tell you, yes, doctor, you are going to give me some instruction or some advices. I'm here to listen to you. So you'll be in the same page with him. What do you think the main task here, Dr. Ines, in the scenario? Talk about the lifestyle, right? The lifestyle and the medication. Imagine when you start to explain the medication. Do you think is it correct?
No, it was like in the last 2 minutes.
Yes, when I said 2 minutes left, you start to. That's why you were in hurry to explain what are the medications and what the job of this medication, which is away from your task. So please, the task is to start with the lifestyle. Yes, you can give advice of stress-free, do some exercise, you can walk a lot, along with the rehabilitation program or the rehabilitation team, because you have to arrange the exercise gradually. Don't start with a strenuous exercise. It might hurt you or it might hurt the heart. Okay, so this is the, yeah.
I think you
Yeah.
mentioned one thing that could have changed the whole situation is what do you expect me to tell you today? Or what do you expect me from today? I think that way I would have been guided, but I did not ask that questions. But I'll do it inshallah bil exam.
Yeah, this is the best question to know what's in his mind and in her mind, and accordingly you can start. Maybe she will give you first concern, and this concern will give you mark for the concern. Let's go back to the other advices. Okay, the smoking. I agree not to give details about smoking cessation. This is not our job. We always say if he's agree, we can refer him to the smoking cessation clinic. What is the mood? How they can do it? What is the method? This is their job. You are here, the cardiologist, but you have to give him a hint that there is a lot of options for the smoking cessation. Okay. Regarding alcohol, yes, if he said I am not, you can say you can appreciate that. Whenever the patient is doing something bad and he stopped it, like smoking, he quit the smoking. Please appreciate it. We appreciate stopping quick or quitting smoking because it's so harmful for your heart. This is the second point. So the smoking, the alcohol. Do you drive? Immediately ask about driving. Why? For how long you can stop his driving, Dr. Ines?
If it is a group 1 and we've done the intervention with a good ejection fraction for a week, if his
Yes,
symptoms,
exactly. It's a 1 week. Why? Because it's a successful PCI.
yes, with a
Okay,
good
1 week.
ejection fraction, yeah.
Yeah,
From the intervention or from the heart attack?
from the intervention.
Okay.
Okay, because it's mentioned after the PCI. The next thing, or the next point, the flying. For how long you think the flying is prohibited for this patient?
I've never came across it, so I don't know.
Yeah, you can say I will refer you to the regulation, aviation regulation. They can tell you. But I think what you answer him?
I said, I don't think there's any problem. You can
Yeah,
fly whenever
see,
you
yeah, I remember you did something wrong. So if you are not sure, don't tell him yes, it's okay to fly. Maybe
So,
it's not allowed. Maybe it's allowed, but
so
you are
where
not
should
sure.
I find this
You
from?
can. There is a aviation regulation for the
Ah, I see. Okay.
yeah for the airlines.
Okay, yeah, I got it.
Yeah, but I think mostly it's 3 days. If
I'm
I'm
not sure.
wrong,
I'm
if I'm
not sure how
wrong, I
many
think it's
days.
3 days, but it's subject to personal assessment. But generally, I think it's 3 days.
I'm not sure for
But
how long
for
really.
all these patients already said that his meeting is after 2 days. So still, I don't know.
Yeah, that's why I'm not sure. I cannot say it's yes or allowed or still not allowed. For how long?
Yeah.
Actually, honestly, also I don't know. But the best answer is let me refer you to the regulation, aviation regulation, or let me check the guidelines, and I will update you in the next meeting. But don't say it's okay, you can go, and you are not sure. Or you can say I don't. I stop you, and you don't know. So the best way is to make a diplomatic answer. I will refer or I will check. Okay, and it's safe answer by the way. It's not risk one. The next point, the medication. You explain the medication and the mechanism of action of every medication, but you didn't tell him some of the side effects. What do you think the safety netting in this scenario?
I didn't have time, but yeah, I
Yeah,
needed to
because you
mention
started
about the
late.
bleeding.
Perfect. Bleeding. What else? So please, if you have any hobbies, you can postpone your hobbies because he will be on antiplatelet, two antiplatelet or dual antiplatelet, the aspirin and ticagrelor, which is very potent
Yeah,
antiplatelet. For how long he will take
for
the ticagrelor?
1 year.
Almost 1 year. Yes.
Yeah, and atorvastatin. I need to mention about any muscle cramps.
Perfect. Yeah.
Okay.
You are here to talk about medication. This is the main task. Yes,
Yes.
lifestyle, one of the more important thing. But the question for taking history, Waste the time plus explanation of the modes of cessation of the smoking. Waste your time.
Yeah.
If you save this time, you will have good time to explain the medication and the possible side effect for each medication.
Yeah, you're right. Yeah.
What about bisoprolol?
Bisoprolol. I'm not sure what is the side effect from bisoprolol apart from some chest. No, not really, because it's selective beta blocker.
Perfect. So what the bisoprolol or beta blocker do?
It's bradycardia, slowing of the heart.
Perfect. So if you feel slowing of your heartbeat more
Yeah.
than you expect,
Yeah.
right?
Yeah.
Please let us know, and always provide follow-ups appointment.
Yes.
We will give you appointment for the next week, next 2 month. You don't know, according to the scenario, or at least 1 month, right?
Sure.
Maybe they are giving 2 weeks after the first discharge, but at least let him know that we will follow up you. It's very
Yeah.
important now to reassure him that we will follow up. Particularly, he's on a new medication. He might have some side effects. So don't worry, we will follow up you, and we will run some blood tests every now and then to check if everything is okay. Okay?
Yeah. Yeah.
Yeah, in general, you did great, but again, don't waste the time explaining unnecessary things,
Sure.
and don't take history. This is a main point you have to correct.
Okay. Yeah. Sure. Yeah. I appreciate that.
Yes.
Yeah.
Any question?
No, thank you very much. Thank you. That's really
Oh.
great. Yeah.
Yes. Okay. Any question, Dr. Kutov, or comment you want to add?
No, that's it, doctor.
Okay. So, Dr. Ines wrote for you the scenario. You are asked to speak to Mr. Ahmed, who has recently been told that his liver, ultrasound, and blood tests show metabolic dysfunction associated steatotic liver disease, MASLT, MASLT. So, speak about this condition and address his concerns. We'll open the discussion until Dr. Kutov will be ready. Anyone want to comment? Any missing point?
Yes, doctor.
Yes.
Beta blocker can cause also postural hypertension or ferritus postural hypertension. How can I explain?
Regarding the postural hypotension, if you feel dizzy while standing from sitting position, please let us know or visit us. Not beta blocker, you mean ACE inhibitor.
It can cause first dose hypotension. First dose
The beta blocker, you or the ACE inhibitor.
ACE inhibitor.
Yes, but you mentioned beta blocker, so you are asking about ACE inhibitor. Yes, you're right. So whenever you feel dizzy from standing or after standing from sitting position, please try to sit down and stand up gradually or slowly. And if you feel like still dizzy, please visit us. Okay, maybe the dose is high for him.
Okay.
Okay. Yes. Thank you, Dr. Lamar. Any other question? Any medication in PACES you are going to counsel about? The mechanism of action, the dosage, the route, the possible and very common side effects, at least one or two, and which are the most common. Okay. And yeah, the complication and safety netting at the end. If you have a lot of medication like this scenario, at least give the most common side effect for every medication. One only is enough. But don't explain without giving red flag or safety netting or instruction about the side effect. Why the patient might stay at home taking this medicine. He will have myopathy, for example, after atorvastatin, and he will come with either rhabdomyolysis or something serious. Why? Because you didn't tell him, and it will be an error. The GP or my doctor didn't tell me about this side effect, and it will be another scenario of communication. The doctor didn't give him the side effect or instruction when to visit his GP, right? So please be honest. Tell the most common side effect, some red flags at the end, and the mechanism of action, as Dr. Kotov or Dr. Inas said. One medication, and every medication, how it goes, how it will be taken. All of them here as oral, right? Some condition, the patient will receive the medication like injection, or it can be most of them like injection. For example, multiple sclerosis. According to the route, you have to tell him. Subcutaneous also like insulin. You can talk about subcutaneous one. Again, the frequency, the route of ingestion, the dosage, the most common side effect, plus the mechanism of action. These are the points to speak in any medication counseling in PACES. At the end, social support, the social history, and the job, some red flags at the end or safety netting to give him some instruction whenever he feel this, please visit us. Plus the assurance regarding the follow-ups or the appointment that we will follow up you every now and then. Okay? Any other comment? If you're ready, Dr. Gutov, we can start.
Yes, doctor, we can start.
Ready?
Yes.
Yes, here you go.
Okay, hello. My name is Dr. Abdulsalam. I'm one of the doctors in the clinic today. Can I confirm that you're Mr. Ahmed?
Yes.
Hello, Ahmed. Nice to meet you. So we're here today to discuss some issues about your health condition. Is that okay with you?
Yeah, please.
So, Mr. Ahmed, do you want us to wait for anyone else before we start discussing?
No.
Okay. So, Mr. Ahmed, can you please tell me how much do you know so far about your condition?
I've had liver issues, and they've done a scan of my liver, and they found a lot of what I've been told, like fats in the liver. And I've been told that today they're going to explain to me about the disease and how to manage it and what is the treatment, really.
Okay, so Mr. Ahmed, I really appreciate your understanding for your condition. And yes, what you said is true. The liver scan and the blood test showed that you had a condition called metabolic dysfunction associated steatotic liver disease. I know the name might be a little long and complicated, but this is basically have you heard about it before?
No?
Okay, so I will try to explain it to you now. So this disease basically means that in your liver, you have too much fat accumulation inside of your liver, and this fat can cause soreness inside of your liver. Does that make any sense to you?
Yeah.
Yeah, so this problem actually come in a spectrum, in a syndrome together. It's called metabolic syndrome, in which there is increased fat in the body, and it has tendency to different other diseases such as diabetes and hypertension. Is that clear, Mr. Ahmed?
Yeah.
Yeah, so this is basically the problem. So in order to manage this problem, the cornerstone of management is lifestyle changes. By that I mean that you need to exercise more, need to focus on your exercise and lead a healthy lifestyle and try to be fit. Clear so far?
Yes.
Yes, and the other aspect we need to focus on is your diet. You need to have a healthy diet and to limit the lipids and the fast food in your diet. And in that manner, I will refer you to the dietitian if that's okay with you, and she will tell you exactly what you can do regarding your diet. Is that okay with you?
Yeah.
Okay. So, Mr. Ahmed, do you smoke?
No.
Okay, that's really good because smoking does affect this condition. And do you drink alcohol?
Yes.
How much do you drink?
A few times beer.
Okay, so are you aware of the recommended units of alcohol?
I don't think I'm exceeding the recommended units, to be honest. Yeah.
Okay, that's really great that you're not exceeding them, but given your health condition now, because your liver is already affected, this condition you're having now is not directly because of alcohol use, but it can really be deteriorated due to alcohol use because your liver is already sore right now. So I advise you to limit alcohol use. Do you
Okay.
think you can do that?
Yeah, I think so, yeah. If that affects my health, yeah.
Yeah, that's great. And similar to alcohol use, we can also limit using of the medication that can affect the liver. Because even in normal person, they can be taken normally, but in your condition, they might cause more harm. So I advise you, if you start any new medication, just to inform your doctor of this condition. Is that okay with you?
Okay.
Okay, that's great. And Mr. Ahmed, that's clear so far.
Pardon?
Yes, and the other risk factors we have to control in this condition, if you have previous diabetes or hypertension, for example, we need to control these conditions by giving the appropriate medication and follow up.
Oh, yes, I do have diabetes and I do have metformin, but to be honest, I sometimes mistaken it.
That's a really important thing to highlight because diabetes is one of the association with this condition. And in order for this condition to be managed, we need to manage the diabetes. So I can refer you to the diabetes doctor to help you control your diabetes. And we need to be really compliant. I advise you to be compliant on your medication as well.
Okay, yeah.
Okay, so you told me that you are not compliant on your metformin.
Yeah.
So why is that?
I did not feel it is very important, and I just feel that I am living a good life. I do not have any symptoms from my diabetes.
Yes, I understand where you're coming from. You might not have symptoms right now, but this condition might be really serious if it progress, because the soreness in your liver can really affect your liver long term, and it can cause some scarring in your liver, which can cause your liver to stop working in the future. So we really have to make this seriously. And the diabetes as well, it can be really serious if not treated. It can lead to really life-threatening complications. Can lead to some damage in your nerves and some damage in your eyes as well. I mean, making sense.
Would it kill me?
Okay, so I really appreciate your concern, but as I mentioned, this disease has many complications, and if it's progressed, it can be life-threatening eventually if it progressed.
Mm-hmm. Okay.
I'm really sorry to tell you that. I know this might be really overwhelming to hear.
Mm-hmm. Yeah, it is.
Okay, so I just walked you through how to prevent this problem and what are the complications that might happen. So do you have any concerns or any questions?
Yes. Do you have any medication for this disease?
Okay, so normally the cornerstone management of this condition is lifestyle changes by leading a healthy lifestyle. But there is some medications we can give, especially since you are diabetic as well. There is some injections and some tablets that can help both conditions to improve. But in this regard, I can refer you to a consultant that is specialist in diabetes, and he can talk you through that.
Is it for my diabetes or for my liver condition? Sorry, I'm confused.
Yes, I know it's confusing, but as we discussed, it is a spectrum of conditions that has actually the same baseline, the same basic concept. So if we managed one of them, we are going to manage the rest as well. So with lifestyle changes, it is going to help your diabetes and it's going to help your liver as well.
Okay.
Okay, that's clear so far?
Yeah, I think so.
Yeah, do you have any other concerns or questions?
I'm just wondering if this is related to my weight because I am 110 kilograms.
Yes, it is directly related to your weight. That's why we are highlighting more about the healthy lifestyle. So if you really worked on losing more weight, it will really help you to decrease this fat inside of your liver, and it will control your blood sugar eventually.
So I've read about the bariatric surgeries, and I can have a surgery where they remove part of my stomach and I lose weight. Would that
2
be an
minutes
option?
left.
Would that
I
be an
understand.
option for me?
I understand what you're coming through. It sounds appealing to have such a shortcut, but usually we keep the surgical options as a last resort if the other as appealing as it sounds. But we usually leave it as a last resort if we failed with medications or lifestyle modification. So we can try first to do lifestyle modification and even medications. Does that sound good to you?
Oh, yes. Okay.
Okay, that's great. Mr. Ahmed, what's your job?
I am a farmer.
Okay, how much does this condition impact on your life?
Not really. Like I said, I've never recognized a difference up until I've had a screen and they found out that I have the issue, but I did not have any symptoms.
Okay, so Mr. Ahmed, as we discussed, we need really a real life change. Okay, and I just want to ask you about if you need any financial support.
No, I think everything is all right.
Okay, that's great. So just can you please recap to me what we said?
So we talked about the importance of lifestyle modifications for this condition and the importance of controlling my diabetes. And I understand you will refer me to the dietitian and to the diabetic team to control my diet and my diabetes. And
Okay,
I'll try to become more active. And I
okay,
need
that's
to take
good.
my medications regularly.
Yes, that's great. Thank you very much, Mr. Ahmed. For now, I will give you some brochures and some reliable website to read more about your condition. And I advise you to contact us in case of any doubt or any new symptoms that you're developing. For example, yellowish your discoloration of your eyes or any other symptoms. If that's okay with you.
Yes, thank you very much.
Okay, thank you very much, Mr. Ahmed. Nice to meet you.
Yeah, that was fantastically done.
Yes, perfect.
Honestly,
Really great. Time is up and
honestly,
you finished everything. Thank you.
honestly,
Dr.
like
Ines, you can.
literally no comments. Like everything was great. Like counseled about lifestyle, explained that it is a part of another syndrome. Um, you counseled about if the patient came in with any symptoms of cirrhosis, particularly like jaundice. I would mention this is like just the cherry on top, honestly. Any jaundice, any abdominal pain, any swelling of your tummy, please just make sure that you present to the emergency department or at least see your doctor for. And great, you give them a leaflet. Um, Sometimes I heard people saying that if you have such scenarios, just tell the patient, I'd like to book you another appointment in 6 weeks, and you tell me how you get on with these changes, etc. But honestly, very, very well done.
Thank you very much, Doctor.
Yes, I agree. It's very nice and perfect performance. It seemed that like Dr. Gotov trained on this scenario before this meeting. Really, she did everything. The only thing I can add to her performance, the follow up. We will also follow up. We're giving you an appointment to check if everything is okay. Because you don't know if the patient or the condition will progress or regress. So, in order to catch any complication early, you have to follow up this patient, right?
Yes. Okay.
Otherwise, perfect. The
Thank
option of surgery, yes, you can do after trial of lifestyle modification. You answer it well. The smoking, the alcohol, yes, I agree. Even you are taking in the limit, still you have to limit it more and more because it has direct harm on your liver. And the other thing, binge drinking. Sometimes they are not considering the binge drinking as drink or alcohol consume. So or consumption. So the best way is to ask also, do you drink as a binge or no? Okay. It's not
Okay.
only regarding the limit. Yes, they know the limit about the weekly limit, but sometimes they are consuming alcohol at the weekend as a binge drinking, and also it has the harm on the liver direct harm on the liver. So the best way also to ask this question, if he has the limit or he knows the limit, you can't ask including the social one, or the if he said yes I'm taking socially, so you are asking is it including the social limit. I mean, if he's drinking the whole week, and he's aware about the limit, you can ask about the weekend part, because some of them they can consider the binge drinking is not one of the social limits. You got my point?
Yes, yes.
Okay.
I'm not sure, but I think
Mhm.
in liver disease, I think there is no shame in mentioning it's better to cut alcohol altogether because abstinence is very important.
Yes, I agree with this comment, Dr. Ines. But you know, as a British examiner, if you speak about cutting alcohol, they are not
Really?
they are not happy with this, really. Yes, I have an experience with them.
I didn't
Because
realize there are British examiners actually in the Middle East. I thought it's like local examiners.
no, they have come to us.
I see. Okay.
Yeah, there is. And I read the comment from one British lady. She's
Mhm.
elderly. She wrote that I lecture on alcohol. I lecture the patient on alcohol. It was like negative comment or feedback as negative.
Felt she felt offended.
Yeah. Why? Because I speak, although the patient is having liver issue, he
I
has hepatitis and the raised liver function. So I give him about some advices regarding the alcohol. But the comment was I lecture him on the alcohol because I said to him, you have to stop it. She's not happy with this.
okay. No, that's good to know. Thank you.
Yeah, particularly you are in UK, so don't speak. If you want, you can say limitation of the alcohol consumption. Okay. Even in our overseas, if you have local examiner and one of the British examiner there, you can speak like this. Although it's advisable to stop totally, as I agree to cut down the alcohol totally, but some, as I said, they are not happy with this. So at least limit or moderate the intake. Okay. Back to the other history or the other communication on this scenario. The introduction, I agree, it was good. The background, the expectation, and the concerns, all the concern was answered well. Let's take one by one regarding it will kill me or will it kill me. It was very perfect answer. Don't say yes, it will kill you, but say it in another polite way. As you know, the liver or the if the liver progress more and it becomes more scarred, it might shorten your life. So you answer like yes, but in another good way. Okay. The other concern was, you can remind me, Dr. Ines, what other concern? So will it kill me? Yes, the option of surgery. There
Surgery.
is. What else? Any medication? Yes, any medication for it. Yes, there is some medication. It can help, but we usually start with the lifestyle modification, along with the
Actually, there
diabetes.
are no medications for it.
If there is hypercholesteremia, the patient might take atorvastatin, right?
I see.
No, actually, because the patient is diabetic, there is an option
Yeah.
for GLP-1 injection, for example.
Yeah, this is
To help
another option.
both of the liver
Exactly.
and the diabetes, because the patient is diabetic, it's uncontrolled. So I think it
Perfect.
would
What
be one of
medication
the
is
wise options. The GLP-1.
it? GLP-1. Okay.
Yeah, it's one of the option along with the diabetes, and diabetes itself can cause dyslipidemia, and
Yes.
most of the diabetic patient will be kept on atorvastatin or lipid lowering therapy, right? So it's the same, but it's not particularly for your condition. So the best way to treat your condition and to prevent progression of the scarring of the lung, of the liver, please control any disease you have. And the good thing here, Dr. Kutuf didn't ask, do you have diabetes? She said it like, in case if you have diabetes, we should control your diabetes. And the answer directly was from the surrogate, yes, I have diabetes, doctor. Will it affect? Yes, it will affect. That's why we will refer you to the diabetic doctor to control your diabetes. And please, if you have any problem with the compliance, let us know. and address it immediately. Why you are not taking the medication, as Dr. Gutov did, and try to see the reason behind that and to solve it immediately. Is it related to the injection? We can have another option. Is it related to the compliance and the forgetfulness? So we can remind you, and please, you can check your blood sugar every now and then. You can even advise regarding the CGM, continuous glucose monitoring device connected to your phone. It will help also to control your diabetes. Along with the diet itself, perfect, you refer him directly to the dietitian. She will give him good advices and instruction related to the diet intake. What to take, what to avoid. It is not the time to explain what he can take. The dietitian will do so. Okay, the red flag at the end, very important. If you notice that your eyes become yellow or you feel very painful tummy or discomfort in your tummy, also visit us immediately. I think, as I said, Dr. Gutov did it perfect. Like she is just trained on it before practicing with Dr. Ines. Perfect, Dr. Gutov. No comment really.
Thank you, doctor. Thank you very much.
Okay, anyone has comment or want to add any comment? Dr. Khalid.
Regarding
Yeah.
the issue of medication,
Yes.
I think there is new medication called the resmetirom, but this depends on the stage of, is it steatosis or
Mhm.
steatohepatitis or went to cirrhosis. Resmetirom can be used if no cirrhosis, stage of steatosis and steatohepatitis. Yes, agree. The main point, lifestyle medication.
Perfect,
But
yes.
resmetirom is given to medication to GLP-1 and also sometimes I think bioglucagon, right?
Yes. She mentioned it, yes. GLP-1, yes.
And bioglucagon also can be used.
Actually, beyond the basis details of the medication is not necessarily to be added. If you mention the lifestyle, as you said, if she asks you or he asks you, there is medication, possibly there is, and we will refer you to the liver doctor to prescribe for you or to tell you about this in another meeting. They will not blame you that you don't know this medication. Okay, the communication
Yes,
scenarios is not the test for knowledge. They test you how to deal and how to manage the concerns.
yes, because this is now MASH or NASH, now is
Yeah,
trend
yeah,
scenario. I think in Egypt,
yes,
him as a LCC, long clinical consultation.
yeah,
So
I agree.
sometimes expect examiner may go with you further.
Even in the LCC, believe me, they will not go deep to the level of asking what medication. Okay, they might ask, but it's not to minus you. It's the question to give you the full mark in the clinical judgment, for example. But if you control the other things like lifestyle modification, the diabetes, the medication that can help in controlling the diabetes along with the liver, so the examiner give you a good mark. But you have to know them. It might come to your exam, and you have to answer if there is possibility to ask you what medication. And please don't start as the pharmacological option first. As we know, non-pharmacological, then pharmacological. Non-pharmacological, you can utilize 30 seconds telling about the non-pharmacological, which is very important as well. Then go to the pharmacological options. Okay. Thank you, Dr. Khalid. It's a good comment. I want to add also to the comment regarding any counseling about any disease. You have to explain the seriousness if the patient will not take the medication or will not follow the instruction. What will happen? The seriousness of not to be treated well or not to be compliant to the medication. Unfortunately, I am so sorry to say, and I'm afraid to say, the liver might have scarring, and the liver is very important in our life, in our body. It helps to break down most of the content of our food. If the liver being scarred, maybe with the time it might affect even your life. It might deteriorate your life. As we know, the end-stage liver disease or the chronic liver disease, most of the patient either need transplant or they die in the complication of chronic liver disease, right? So in any disease, there is complication. Explain the seriousness. Might happen if the patient is not compliant to this medication. Clear? And also Dr. Kutuf did it perfectly. Anyone want to ask or to
Dr.
comment?
Basil, in
Yes,
such a
Dr. Khalid.
scenario,
Mhm.
still in such a scenario about alcohol,
Yes.
wise to advise the surrogate to stop alcohol ولا limitation because
I
here
told you, yeah, I agree with you. Okay, if you have British examiner, the gray one and with the green eyes with the yellow hair, you know the British, the original British, so you will know them. Please don't stop the alcohol. You can limit the alcohol, or you can say you can take the alcohol within the limit. If he is taking within the limit, please reduce your alcohol, but not to cut it. I told you in my experience, it was liver disease and the patient is drinking alcohol. I tried to give him some advices, and the comment was he lectured on alcohol. Imagine the British examiner wrote that, and the local examiner, he said or he wrote it as a positive comment. He advised regarding alcohol. Imagine the opposite. Why? Because as you know, they respect the alcohol there. Maybe even the examiner himself is drinking alcohol. Really, it's truth. So I cannot say or I cannot advise you to stop it totally. If you have British examiner, don't stop. If you have local examiner with another one looks Muslim, you can tell him cut down your alcohol. To be in the neutral way, say limit the alcohol intake. If he is even taken within the limit, you can tell him reduce your alcohol. Okay?
good, thanks.
Okay, thank you, Dr. Khalid. Dr. Inas, comment. I am very grateful. I need to go now. I'm sorry, my daughter is quite restless. All the best. Thank you. Okay, thank you, Dr. Inas, as well. Thank you, Dr. Kutuf. Anyone want to add any comment? Any question? I hope it's clear for all. Both scenarios today was about like counseling about medication, and the other was counseling about condition. And the liver disease now is trending, as Dr. Khalid mentioned. Please be ready to address and to counsel how to know about the liver disease, how to speak about the alcohol in any liver disease, not only in our today scenario. If no question, we can end the session. See you tomorrow, inshallah, with a short clinical station day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, doctor.